Good morning, everybody. Welcome to the very last day of Dreamforce. Kudos to all of you, by the way, for being here, because the Friday morning session is always the toughest after a week of a lot of activity, late nights, good parties, and I know there's a lot of folks who have trouble getting back to the East Coast with flights. So I definitely want to give everybody in this room kudos for showing up to the session. We're very excited to go ahead and present to you today. And we're going to have a great session here today. So first off, by way of hands, I always like to know, who here has been to Dreamforce prior to this year? Okay. Who here is not? Who here is the first year at Dreamforce? Great. So special kudos to those of you who are here for the first year, but the reason I'm asking that is because it really gives an indication not just of how many customers have over time gone to Salesforce.com, but also because it really shows indication of where we are in the healthcare space, in the life sciences space. 3 years ago, Salesforce, a lot of people really just attributed to kind of, manufacturing, retail, kind of widget-based organizations, like I always like to say. But, we've actually gotten a lot of progress and a lot of success in the healthcare and life sciences arena. And I think, seeing how many people are here now today is a good indication of some of that growth. So we have a great agenda here today. We've got 3 great speakers that you're going to hear from. My name, first off, is Glenn Bronstein. I'm a sales engineer with Salesforce.com. I work in Atlanta. I work with a lot of large healthcare customers in the Atlanta, in the southeast area, a lot in Tennessee, Memphis, Nashville, Atlanta itself, Florida, we have a few. And I'm joined up here with the speakers who we have Paul Stevenson from Amerigroup. We got Bob Bennett from Family Service Agency. And we have Don Lamping from Zimmer. Okay? When I put the session together, healthcare and life sciences, it's a huge area, right? A lot of different companies, a lot of different types of companies. Maybe you're a payer, maybe you're a provider, maybe you're medical, medical devices, maybe you're pharma. So the goal, my intent in putting this together today is I got 3 speakers across 3 disparate areas of healthcare. So what's nice is you're going to hear 3, very unique stories to their industry, but you're also going to hear a lot of commonalities in what they're doing with Salesforce.com. Probably seen this way too many times this week, right? It's our safe harbor statement. You can really read more about it on our website, and I encourage you to do so. So what is special about this session? Why are you here today? So some of you might be sitting there and saying, well, I'm a healthcare company or I'm a life sciences company. You don't sell widgets, right? And a lot of people traditionally thought of CRM and Salesforce automation as being a great type of solution for companies that sell widgets. So that's a little unique in the healthcare life sciences space. Some of you might be saying, you know what, we don't sell to customers. We don't really sell and close deals perhaps, but we market to customers. We influence customers in the healthcare and life sciences space. So you might be here thinking, trying to find out what can we do unique to that goal. Compliance, right? I don't care who you are, what company you're with, healthcare, life science, compliance is huge. So how can you use Salesforce to help you remain compliant? How can you keep up with the regulatory changes when it comes to compliance to ensure that year after year you can keep up with those changes and remain compliant as an organization? Some of you in the room might be saying, I'm a nonprofit, right? I don't sell widgets, I don't market maybe, from a kind of product perspective, but nonprofits obviously are very different in the way they, engage with your customers and your clients. So that might be another thing. And finally, in the healthcare and life sciences arena, the customer, right, the C in CRM, it's different. It's not a product, oftentimes a product-based customer. It's not a customer who maybe are forecasting product sales. And so, again, customer in a lot of your situations is very different. So what we're going to talk about today is how you can use Salesforce, and we're going to get great stories from each of these presenters, and how you use Salesforce to help ensure compliance and help you keep up with regulatory changes. How you can use Salesforce to manage a lot of your marketing efforts, your community relations efforts, and how you use metrics to really get your handle around that. You're also going to hear a story about how Salesforce can be used to really develop and manage a center of excellence, for governance reasons and, maintaining, the most efficiencies out of the system. And finally, operational efficiencies. How can you use Salesforce to drive operational efficiencies, and how can you encourage your users to really get in the mindset of improving operational efficiencies? So with that, I'm going to turn it over to the panel here. Like I said, Paul Stevenson is the Associate VP of Marketing Operations at Amerigroup. And we'll then go actually over to Don Lamping at the end, who's Associate Director of CRM at Zimmer. And finally, we'll wrap up with Bob Bennett, who's the President and CEO of a nonprofit right here in San Francisco called Family Service Agency. So I'm going to turn it over right now to start off with Paul.
It's especially good to see you all come all the way over here to this zone over here, the obscurity zone. But thanks for coming. And just tell you a little bit about myself. I am a CPA, and all my life I've really wanted to be a software developer. And now with Salesforce.com and Force, I can actually live my dream. And so I've really been having fun with this in the last couple of years. And I'm going to share some of what we've been doing at Amerigroup over the last 2 years. We went live in our deployment I'm going to talk about here on April 1st of last year. But we have about 400 people using Salesforce now. I'll go over that. Just a little bit about Amerigroup real quick. How many of you have heard about Amerigroup? And has anybody heard anything related to maybe the Office of the Inspector General or anything about that? I mean, modern healthcare or something like that? No? Okay, I'll talk a little bit about us and that specific instance, but just a little bit about the company. We're a Medicaid and Medicare HMO. Our focus is Medicaid programs, and our Medicare services are really focused on the dual eligible population who have both Medicaid and Medicare. We have about 1.8 million members now. We've had a really tremendous growth rate in the last year due to the economy. Our run rate is around $5.5 billion, and we're in 14 states. Our biggest state is in Texas. We have about 550,000 members there. So we have a very regulated environment, as you can imagine, being in the Medicaid and Medicare business. There's a lot of pressure on us to make sure we do everything right. We have 400 users. 200 of them are in our provider network development area. We treat that as a Salesforce automation process, offer acceptance. Obviously, we're buying, not selling, but it's the same fundamental process. And then we have another org where we have our Medicaid and Medicare marketing. Medicare is a marketing Salesforce automation process where we both do marketing as well as actual sales and commission payments. In Medicaid, it's an indirect process where we market to the recipients of the Medicaid program, but they select into our plan. It's almost like an open enrollment kind of situation you're familiar with probably right now, filling out the forms at work. Okay. So that is a little background on us. So as I mentioned, I'm going to talk about our Medicaid managed care deployment. And the reason I'm going to talk about that is I'll start at the bottom here, is because of the Office of Inspector General. And in 2007, right at the end of the year, or I'm sorry, in 2008, we signed a corporate integrity agreement with the Office of Inspector General related to some Medicaid, it was whistleblower violation. And we ultimately wrote a $250 million check to the OIG. We got a thing called a corporate integrity agreement, which you don't want to have. It's a 5-year probation sentence, sudden death. And you'll get to hire yourself an independent review organization, which is a special auditor, costs extra, and who watches you and gets to tell the OIG if you make any mistakes. So we are under a situation that is really unlike anybody else in the history of the world. There's been 3 agreements like this with health plans, and the last one was in the 80s. Okay, so this is a pretty big deal, and we're really focused on it, as you can imagine. Anytime your CEO signs a $250 million check, you get a lot of attention. So all that being said, now what do we have to cover? What do we have to watch? We have a grassroots effort. We're in 20 major metropolitan urban markets: New York, Baltimore, Washington, D.C., Miami, all the Texas cities, and so forth. No money, not enough money to do any kind of media or anything like that. So what we do is we're out at the grassroots level. We're in women, infants, and children's offices. We're in welfare offices. We're at community organizations who serve the poor. And so we have 75,000 events going on in a year on a run rate. 140 reps out at 30 sites. We have 50,000 community partners. These are our accounts that we relate to. They're referral sources for us. And we have 10 different states, because we have 4 plans in Texas. So we have 10 different wonderful sets of complex regulations. And so then with that OIG thing, we are obviously focused on making sure all that stuff takes place without any violations of any kind. we have two deployments as our solution to dealing with this. The first one is kind of the operations piece, the marketing resource management. And that we handle our reps use the tool to manage their account management, to schedule events, to assign resources to events, to assign inventory to events, and allow us to have a complete record of the occurrence. They also debrief after the event and complete the record out. The second piece of that is our compliance officer support. And that's a custom app that we've developed for confidential observation and review of events and other marketing activities. And I'm going to show you both a little bit of our main operation as well as our quality and compliance module. I guess when we started looking at it, we took a look at my first run-through of the thing, and everybody didn't really want to see the basic records, so we kind of cut that out. Suffice it to say, there's 75,000 records about events that all roll up into our reporting and dashboard. But this gives you a sense of the way, since we're talking today about metrics, this is the way we manage the marketing operations. This is a dashboard for our Houston market. We have about 210,000 members in Houston, Texas. We have 12 reps or so out there. And as you can see, we've got several columns here as the way we've set up our dashboards. This is kind of operational stuff. This is basically just a gauge of where we are for the next week. We're coming into holiday season, so it's not the worst thing to be in red. You kind of expect that. And then we have our event trends. You see some gaps here, and I'll talk a little bit about. We have a retention specialist inbound operation where a few of our reps every week are in the office. And that's a separate deployment within Salesforce. We have 16 people total that handle inbound calls. And I'm not going to get into that because it's sort of a whole other thing. We have about 7 different implementations within Salesforce, as many as roles where we have one person who has a specific role, which I will show you something about what she does. And then we have up to 100 people doing the marketing and so forth. Over here, we have another interesting thing that we've developed, which is, and we have an incentive compensation process that, because it's an indirect marketing process, we can't really, there's no commission, there's no way for us to pay these guys commissions, but we do want to incent them for activities, and we want them to give them incentives for better activities, quality, rather than less valuable ones. So a stop-by visit at a physician's practice is only worth a couple of points, whereas a half-a-day event at Dreamforce for something is going to be worth more points. And the way that we kind of just accumulate those in these event records, and here is an example of how those points are stacking up in the current quarter. And this gives us a chance to look at what's going on. And up here is our look at last month's quarter, so you can have some comparative benchmark. You can understand the trends. Some of these people at the lower end, where they're not scoring as many points, they have reasons that they're not doing that, but it allows you to then see last month or last quarter, kind of what they're expected to do. It gives you a sense of that. And you can see where they are this quarter, and it helps you monitor their process. Down below are a couple of other things that we do. This is event duration. We're very interested in making sure that our reps aren't having 5-minute events and they're out there with the community and talking to people. We also track things like the number of people they interact with, the number of people who attend the events, and so forth. All right. I mentioned a one-person application, and this is an example of the results of that. We have a very large member outreach activity. We make 1.5 million outbound calls using an automated IVR called ELIZA, which is a healthcare-specific tool that, if anybody has any questions about it, I'd be glad to talk about on the side. But she makes the calls out to everybody, and we track what the results are with those. We communicate to them the importance of recertifying for their benefits. That's the purpose of the call. And then we track downstream to see if those people who we were able to reach have indeed recertified and are still with our plan. And so that's how we measure the ROI on that investment. It is a large investment. We spend about $1 million a year on that activity. So this is a setup. Salesforce was awesome for us because she had been doing all of this stuff. Imagine managing 1.5 million phone calls. She's got 14 plans and several products in each plan, and she's got different phone scripts for each one of those groups. And imagine managing that with spreadsheets, okay? Well, that's what she used to get to do. Since then, we've put all that into the Salesforce object. She has awesome reporting capabilities now. And now that we have integrated our member data within Salesforce, which I talked about yesterday, if any of you went over to the IOD presentation, we can now actually attach members to these campaigns, the records she creates. And so she can say, okay, I'm going to call our CHIP members in Atlanta, Georgia. It's a list of 15,000 people. She can attach those to the member record. And so each member, if you go and look, they have a record that says, oh, we made Eliza phone call to them. Okay? And when we get the information back from Eliza that they did reach her, we enter another entry into the system and show that this was a person who was reached, or this was a person who was not reached. And that allows us downstream, we push all of our Salesforce data into a SQL environment. It allows us downstream to do heavy lifting BI work on all of the data. Stuff that you can't really do in Salesforce. It's not designed for that. So an example of a couple of reports that I have here in the member loyalty area are, here's all these campaigns I was talking about. Tampa, 2 products. We've got health promotion, actually outreach, and a retention outreach. And you can see that it just all stacks up, and you can report on it, slice it, and dice it, and it's really a great way to go. A lot better than hundreds of spreadsheets that essentially end up dead ending, because at some point the spreadsheet goes into the folder and gets saved, and you're not going to ever go back and pull that data back up to look at it. Okay, I'm running out of time here, so now let's get to the compliance object. Our compliance object is really pretty simple looking, and as you can see here, what it is it's a review process. We have set up, with our agreement with the OIG, we have set up a process called the MIP, our Marketing Integrity Program, which includes a systematic process of reviewing each rep on a regular basis to ensure that their events are within compliance to all the regulations and policies. And so we go out and we just visit these events. And I have both my managers doing it. That's why we call it quality and compliance. They do a quality thing. And their tests are not only on compliance. Do you have your badge? Did you show up on time? Did you have the right materials? But they also are concerned about our brand image and the person's knowledge about the products and the network and the market and so forth. So we have them doing quality. And then we also have our compliance officers. And that's the part where I mentioned the confidential piece. Compliance officers can operate in total obscurity, if you will. They can assign or they can set up a review, plan to go and review an event, and the folks in the marketing folks don't have any idea of that. We can do secret shopping, for instance, in the system and so forth. This is a visual force page. The back, it's underpinned by some pretty sophisticated Apex code. It sort of looks like a simple form, but it's sort of a Rolex in the background. It pulls all kinds of history data. You can't set up a record for yourself. You can't change records unless you have authority to. And so we have kind of another layer of security on top of the already significant security that's built into Salesforce. So last, I will show then the results of this process. What's really amazing about this and why we had such fantastic adoption, all of our folks are really happy with this, is because if you think about what it would be like to have to do, say you have a plan with 20 reps and you have to do 6 reviews per quarter on each one of them. That's 120 reviews. You think about what it would be like to have to do pieces of paper. And then once you got done with the pieces of paper, you'd have a stack of them, and then you'd have to do something with that stack. The beauty of this is that once you do the review within the system, you're done. Okay? You don't have to send anybody an email about it. You don't have to report on it. If our compliance people want to see if the marketing officer's been doing reviews, they just go into the system, their users, and they pull the reports themselves. So this allows everybody to have total visibility. And what we have here, for instance, is I'll show this graph here. In Georgia, we basically have a real simple way of looking at the reviews and saying, okay, I need to have 6 per person. And where am I in October, November? Well, I got December to go, and it looks like I got a few more reviews here to take care of for these people. So it really lets us have a bird's eye view of the whole process. And the ultimate result has been that we've had tremendous success in the last couple of years. Our same-store growth has gone from 1.3 to 1.75 million members, and we have simultaneously decreased our expenses by 40% in marketing. This year, we're going to take another 40% bite out of this in 2010. And we are, our efficacy is up through the roof. We have the best events. We're still doing. We're not doing any of the less valuable stuff, and we're getting great results. In addition, the compliance process has been really fantastic. It's been accepted by the IRO, and in fact has allowed them to reduce their level of audit effort in the field. And for us, that is, I just can't describe you what a sigh of relief it's been. So it's been a really great program. And if anybody has questions, I'll be glad to. You know, that's a good question. Our marketing reps really didn't have an information system prior to this. We had, the various markets sometimes had something going on, but they didn't have any form of account management. At the most, they were trying to do basically counts of how many events they did for their IC program. It was just a simple account. I had to do 250 events a quarter. And so they didn't have any system. They didn't have any way to manage anything. So when we first put this on them, we did two things. One was, well, they were both wrong. One is we went way overboard. We did the whole IT thing. The business analysts came in. We got 183 requirements, and we implemented it with a huge pro services project, and they were choked, basically. It was just too much. As we pulled back, took chunks of it away, said, oh, you don't have to worry about the cost of the events. Don't worry about the inventory, the handouts you're taking. Yeah, just focus on a thing. And we started to trim it back. We got real big traction with them. And then, once they started to realize how much value there was for their process in having account management, they are 100% behind us. We have awesome adoption. And then as far as the compliance object, we've also had very high adoption, mostly because once we created that object, we were able to push it to mobile immediately. And you can do it right here on your BlackBerry or your iPhone, which I would be glad to show folks later. Thanks.
Let me do this if I could real quick. So we're going to hold questions to the end. We're going to probably have a good 10, 15 minutes, I'm thinking, so we can go ahead and pose questions to all three speakers. Okay, but thank you, Paul, for that one. Appreciate it. So now I'm going to go ahead and introduce Don Lamping from Zimmer. And Don's going to go ahead and talk about what he's done in a lot of areas with compliance and Center of Excellence. And I will not steal his thunder, but go ahead and
thank you,
Clint. Don. Thank you.
Well, welcome, everyone. I'm Don Lamping from Zimmer, and I'm going to jump right into it due to our time here. So we have time for some questions. Zimmer, as you can see up here, we are located in Warsaw, Indiana. We design, manufacture, deploy the widgets, right? The knees, the hips, the shoulders, the joints. So we're in the ortho world, and we're a global-based company. As you can see here, 8,500 employees and sales in the area of $4+ billion. So we have roughly globally 700 users in the Salesforce cloud, and it's good to see Wolfgang here. Kudos to you from Salesforce. Wolfgang represents our Salesforce team over in Winterthur. So we, again, are global. 700 of those users, some of those are based overseas, obviously in Japan, Australia operating, and in Switzerland and the EMEA area. And then the other portion of that is our U.S.-based team out of Warsaw. So we're using the Sales Cloud, we're using the Service Cloud, we've got mobile going, sites, and a recent partnership with ExactTarget that you'll see a little bit of metricing on them. So here's the portfolio of the orthopedic products that Zimmer does offer. What were our challenges with the CRM space? And it's interesting because CRM traditionally, 5, 10 years ago even, you would think of opportunities and lead management and the traditional CRM components. And as Paul alluded to with Salesforce, it's a whole different world, not only from the ease of use, the ease of implementation, but the things we're trying to do in here. I mean, yeah, you see traditional lead generation, but now we're seeing things like legal and regulatory. What's up with that in a CRM environment? Well, you may have heard of the deferred prosecution agreement that all the orthopedic companies as well as the pharma companies have gone through in recent years. And long story short, it's basically the government's engaging with our businesses to say, these are the limitations. These are the things you've got to comply with in your day-to-day customer relations. So we had to find a way to get legal and regulatory if you will, folded into the CRM environment. And you'll see some things in that space. And then the biggie is, for us, the multi-instance. When I came on board with Zimmer over a year ago, we had, I think, up to 8 CRMs going on. And those could be Microsoft. Those would have been Sage, Sugar, SalesLogix. But 5 of those were Salesforce.com. We were our own worst enemy. We had 5 instances, different price points, different number of users, different functions and features that we weren't globally leveraging. So you'll see some metrics around how are we combating that. Because in a heavily competitive world, some of the traditional components you don't want to stand up here and talk about, right? You don't. Here's how we're competing against Stryker, who's probably sitting in the room, or here's how we're, combating some things with Wright Medical, as we had a luncheon with them yesterday. It's great to have that discussion, but we've got some things that we can all talk about that we all share as pain points. So let's go into these 3 business challenges and what we've done, solution those. So I'm going to show you 3 solutions to the lead generation problem, the legal compliance problem, right? The global problem we had. One solution in the area of leads was ExactTarget. And ExactTarget, it's on my mobile device, it's on the app, we're getting notifications, our surgeons are getting communications, but we're going to see some web to lead and how we're integrating some social media. You'll see some components there. The second solution was our legal and regulatory, a custom cloud application, where we're now modified the traditional CRM approach to say, wow, we can capture some legal compliance types of issues that we have in the company, and it appeases our internal network because some of our legal people are saying, I don't know, we can be doing some of these functions within Salesforce. So this was a way that we could metric, dashboard, notify, and integrate the legal side of our business to make them happy, to make them realize this isn't something we're doing to violate policy. Actually, we're going to complement the policies that are in place. And then finally, we introduced a Center of Excellence. So the Global Center of Excellence is headed up by our 2 or 3 of our vice presidents, as well as each business unit, including the European teams, the Japanese teams, the Australian teams. We truly have a Global Center of Excellence now, and that Center of Excellence is setting up our roadmap for our future, so we know when can we migrate these 8 instances into a single platform, because that's not only Salesforce recommendation, but that's the guidance most generally all companies are going for, is not being a global company, but acting like one and sharing information. So here, what I'm doing is, quickly let me go back, these 3 solutions, I'm going to just show you 3 dashboards and components and how we're kind of solutioning those, since this is analytics and reporting. The lead generation component, here on the left, I don't know how many show of hands saw the Roambi, R-O-A-M-B-I demo in the expo this week. Did anybody see that? Nobody saw it. It's tucked away way back in the back of the mobile apps on the right side of the expo, but an excellent, robust application that's kind of a turnkey approach to metricing. Because as you well know, there are limitations to some of the dashboards, although we have some new features coming out here in the spring and summer shortly. Roambi, they've really taken dashboarding and metrics to the next level. And anybody after the meeting, I can show you. I've got that on my iPhone to show you some of these. But they're very, very fluid, very turnkey, like I said, dashboards and gauges. Here's just a quick example of a screenshot of that. We can capture, and we are capturing by lead source within one of our global instances that we're taking of where our events are coming in from. And then we've got some surgeons. This is an ExactTarget metric. How many surgeons are opening our emails? And I can drill into that. And, if it's my surgeon as a sales rep, I not only know which corporate messages are going out, but as you well know, show of hands, ExactTarget, any partners in here that are working with them? Great. So you can resonate with that type of a metric there. And then this is the actual open rates for some of our ExactTarget campaigns. So traditionally, all right, you wind back the clock at Zimmer a year ago, these are things that were fairly nebulous. You knew people were emailing. You knew surgeons had interactions. You knew you were attending events, but we couldn't see these results. And now we not only can see them, we have benchmarks to move forward. The next challenge was legal and regulatory. Now, Dr. J is not a real surgeon here, but I did put him in here for my demo because I thought, confidential information here. But what we can see is in our compliance area, they want to know internally what are our sales reps and marketing people saying in the system. Because there's some free text areas in this tool that we don't want to be talking about, outcomes necessarily. We don't want to be talking about what we're doing with our product from a legal standpoint or, misuse of a product or an instrument. We want to capture certain keywords, and I think I'm up to like 50 plus keywords that we are now monitoring. So this dashboard depicts when a keyword's used, and then we've got a compliance individual that approves that keyword being used. And then that record is then removed from our queues. And a couple of other things here. We can see, some of the open rates over here, which surgeons are opening geographically. And then here's free text within our actual sales channel, which reps are free texting. Again, I cleared all the records out, one for everybody. But you literally see what comes to life as a particular rep who likes to use the word, complaint a lot. It's like, that's a problem. We need to either coach him or educate him on what we should compliantly be saying and doing with the CRM system. And then finally, our Center of Excellence. So what we see up here in the top is our model on our 5 Salesforce platforms. We know early this year there were some major cost reductions because we do have 5 instances. I know with Wolfgang we've got a certain price model there. We've got a price model in the U.S., price model in Japan, price model in Australia. We have these price models all over the place. Not only do we have price models with these instances, we have users, we have administrators, and resources supporting it. So that cost structure, we're seeing reduction to say, let's start this consolidation process. Let's put in a global center of excellence, and then let's focus on reducing all the multiple dollars we're spending to build a function out in the Winterthur instance versus the U.S., the integration to 5 instances. And literally, our roadmap is to be 1 instance at some point. But it's not like tomorrow, right? We've got other things, projects that we're working on within our global focused instance other than just migrating everybody to 1 platform. And then here we have, over the last 7 days, the number of records being added. So what's another key factor at Zimmer and a key concern for us is data integrity, as it is with anybody. When new surgeons or new hospitals are added to our system, we still allow that to happen, but we want to monitor, is it correct, who's creating them, because we want to make sure our data is clean. And then finally, this is just a breakout of those users by area. So in the U.S., 517 users actually accessing the system. Other are EMEA and other countries, and then Brazil and Mexico, we can see a large tick there. So to sum up everything, results, we have a 35% open rate on our campaigns. It doesn't say a growth, no, because we just set the benchmark. That's our open rate. We didn't have an open rate a year ago because we weren't tracking it. And a lot of our metrics you're going to see within our organization, because Salesforce is fairly new in relation to these components, aren't trends up or down. They're actually benchmarks. So hopefully next year we'll be talking about what these trends are. Our open rate, we got a 95% delivery rate, and then our lead volume and lead visibility, as you could see based off our dashboards, it's actually present, right? We never had the visibility at all. And then in our legal and regulatory area, that we definitely are getting more and more in tune with what legal and regulatory are focused on to make sure we can prove and document these data points for them and give them that better visibility for them real time. And then the COE that is developed, with that team in place, we now have a focus at Zimmer to work globally and act globally. So that's kind of in summary what I've got, and we'll take questions here after our next presenter.
Sure. Thank you, Don. And actually, we're actually doing all right with time. We could actually take one quick question if anybody has for Don right now, and then we can hold any additional ones at the end. Anybody got a question back there? Here, let me actually give you this if you don't mind, just so people can hear. Sure.
Hello. Can you hear me? Yeah. You talked about the Center of Excellence. Was that primarily a business-driven group or an IT or collaborative? How did you put that together? Because I think there's a couple of things in there, isn't there? That one is the business and what you want to do with those instances around the world, and then how do you actually physically go about doing that from an IT perspective as well?
Right, and I'll go ahead and address the fact that we at Zimmer definitely have challenges like any company. We do have a PMO, Project Management Office, and what's ironic is many of our projects for Salesforce don't even go through the PMO. One would think, well, wow, that's where things should start from an IT's perspective. That's a definite shortcoming with Zimmer, which actually sparked the thought of the Center of Excellence. And we've been partnered with Salesforce to build this Center of Excellence. But I think to nail your question, it's a very business. So it's a business-focused approach. And the composition of that team, while IT is present, as well as the PMO owner, is present on that team. It's a very business focus from a dental business to a spine business owner. So it's the president and vice president levels of those channels to make sure those instances of Salesforce are going down the right path in their mind. So they can start to draw the line that if they're investing more resources in their particular business model for CRM, it's in concert with the global approach.
Yeah,
so it's definitely a business focus.
Thanks for that. Thank you.
Okay. Well, thank you, Don. Appreciate. And now we're going to switch gears a little bit and go from Amerigroup on the health plan side and Zimmer on the medical devices side to something entirely different, but nonprofit. So I want to bring up now Bob Bennett, nonprofit agency, nonprofit organization here in San Francisco, and let you take it away, Bob.
Thank you. So I'm going to take you guys to a real different world than the other two. Family Service Agency is 120 years old. It's San Francisco's largest social services nonprofit. We serve 12,000 clients annually, including probably everybody who asked you for spare change during the time you were here. We have 6 major service sites, 250 staff. And one of the challenges that makes Salesforce very appropriate for us, we have 78 major funding sources and 24 different programs. We serve all age groups. We run the county's largest child care center. We serve about 95% of the teen moms in the city. We serve most of the severely mentally ill individuals in the city. We actually have 280 users. And if you count the other agencies that have now adopted our system, we're up closer to 1,000 users. So even though we're a small organization, we're kind of comparable in number of users to these two big guys. Our application we call CIRCE. It stands for Consumer Integrated Record of Care. It's HIPAA compliant. We are the winner of the 2007 APPI Award for Best Nonprofit Application. We had a historic founding director, a woman named Kitty Felton, who did a lot of things in the history of social services. But one of the things she did was she invented the manila folder. Our agency was in charge of serving people who were homeless after the San Francisco earthquake. And before, all social service agencies had bound books, and they'd write what they'd done for a client in the book, and then you'd have to flip back through the book to find the client. All of a sudden, we had 20,000 clients, and so bound books didn't work anymore. And we invented the manila folder, which was really the world's first random access memory. So 100 years later, when I came to be CEO of Family Service Agency, we were still using manila folders, thousands of them, roomfuls of them. All that information was used only to document that we had billed appropriately for our services. Other than that information was dead. And our direct service staff were spending about half their time collecting this dead information. We also, because our fiscal system was so complex, weren't really able to track productivity, earnings. Our agency was a mess, and our agency was really on the verge of bankruptcy. We needed to get our records automated. We needed to manage with numbers instead of anecdotes. One of the things that's, I think, true across any organization that sells human interactions, mental health, law, accounting, is that most of the employees think they're overworked and underpaid, and they all think that there are plenty of other people in the agency who are doing a really bad job and getting away with it. So it creates a very negative atmosphere in the organization. And it's really not because of a particular organization, but because of the nature, I think, of what's being sold. So CIRCE, our Consumer Integrated Record of Care, captures the documentation requirements of the 13 largest programs. Each staff person and program manager views only the documentation and metrics required for their job, which is not actually strictly true. Everybody in a program looks at what everybody else in the program is doing. And every program manager looks at what every other program manager in the division is doing. And that's important for the morale issue, as I said, because all of a sudden, people realize who's doing a good job and who's doing a bad job. And we did have one program that was not good. But the rest of the programs were good. And being able to see how their programs compared to other programs has really created a spirit of collegiality among our staff that wasn't there before. It also lets me as CEO and all the rest of our administrative staff track our enterprise, how we're doing across all these different programs. We fired a staff person when I first came for basically falsifying her charts. And she went to the county and claimed that everybody was falsifying charts. And so we shouldn't have fired her because she was just doing what everybody was doing. So we got an audit. And the audit actually found that she was indeed the only person who was falsifying charts. But lots of our staff were collecting very sloppy documentation. And the result was that we lost so much in audit exceptions that the whole survival of our agency was threatened. So the second thing we needed to do was really track the health of our charts, to be able to make sure that our charts were in compliance. So the next time we got an audit, we would not be at risk of failure. And also so that we could actually discipline employees who were not doing a good job without the feeling that they could go out and complain about us and bring down a torrent of audit repayments. We also established performance metrics for each program. It took us a while, because all of a sudden we went from no information to a vast amount of information. So it took us a while to figure out what information was important. We finally settled on three things. One is chart health. Every chart has to be in audit compliance. No chart can be out of audit compliance in any way for more than 30 days. Secondly, time to data entry. Our staff have 72 hours to enter a case note documenting a visit with the client. When we first started, the average was 40 days. You can imagine how many visits were just getting lost in those 40 days. Then we introduced an operations committee where the program managers get together and they go over their metrics. It's on an exception basis. If they're not meeting their metrics, they have to give an analysis why, and then they have to come up with a plan to improve those metrics. I don't know how many of you are in nonprofits, but it's very transformational to teach your managers how to manage. And that's what Salesforce has done for us. And again, we introduced the management training we needed to get our managers to learn how to manage this transformation. We actually did not care about CRM at all. What we realized was that Salesforce is an incredibly robust, low-cost development platform. And so this is what a service provider would see. Every one of these is a little different depending on what program they're in. But you see, across the top are the same tabs that would have existed in the paper chart. Contacts, episodes, these are all ones we added. Progress notes, plans of care, reports. I won't dwell on this, but this was so similar to what they were seeing when they were actually filling out the papers by hand. These are the dashboards, and everybody has a set of dashboards appropriate to their role. These are mine. Here is chart health. This tells me how many charts are out of compliance. And if it wasn't a violation of HIPAA, I could click through and tell you exactly what was wrong in each chart. This is days to data entry. You can see that we're not necessarily hitting our target. Our target here is actually 5 days because we let people go because there's a weekend, they might have a weekend. So half of our, 40% of our programs are actually not reaching that target. The third one is productivity. Our staff are required to do 5 hours of billable service every day. The results. Our documentation time went down by 50%. And since we were spending 50% of our time on documentation, that means the time we spent actually being able to work with clients went up by 25%. Our billable hours per FTE increased by 25%, which means that we were able to earn our contracts with 25% fewer staff. So we've been able to increase our staff salaries by 10%. We've been able to actually go, we had a deficit 13 of the 14 years before I came. We haven't had a deficit since we implemented this system. We've had an operating surplus every year. And then charts with auditable flaws are down 35%. This is actually not exactly the right metric. We had 40% charts with auditable flaws. Now we have less than 5%. So it fell from 40% to below 5%. And the change in our organizational culture, it's hard to describe what a transformation this has made. From a squabbling, negative bunch of people who felt persecuted to people who feel like they're all part of the same enterprise and all working toward the same goal, and feel that their peers are also working toward the same goal. Key takeaways. I know so many organizations that think a software system is going to solve their management problems. A software system gives you the tools to solve your management problems, but it really took us 2 years after we had the tools to really figure out how to manage with the tools. One size does not fit all. Actually, what's wonderful about Salesforce as a platform is that it's not just a mental health vertical market app. It's not just a teenage pregnancy vertical market app. It's not just a school management vertical market app. It can be all those things. And you own your own code with it. And most nonprofits have many different funding sources. They cannot be served by a single vertical market application. What we're trying to do in San Francisco now is to create a nonprofit cloud that will float below all of these mandated government IT infrastructures that will let us share data with each other about clients, share metrics, share capacity, and then migrate up the required data to the government funding sources. But let us really manage our agencies in a way that makes us really tight and operationally efficient. We believe we're as efficient as any corporation in San Francisco. And that's something we're proud of and something we'd like to see migrate out to all the other nonprofits. One of the great things about Salesforce is that you get a stable platform, but you own all your customizations. You are not the prisoner of any vertical market provider. So for nonprofits, at least, that's a major, major plus of Salesforce. Oh, and that's my fourth bullet. So it's my third and fourth bullet. That's mine, actually. That's yours. Okay.
Okay, great. Thank you, Bob.
Thank you.
And actually, we do have time for one quick question for Bob directly, if anybody has. Like I said, we'll have time at the end for some more Q&A. Anybody have?
So is this a totally open environment, or you have also roles and hierarchies at different points?
Oh, it's not totally open. No, we have roles and hierarchies. And they're fairly precisely defined. But within each program, we have teams of staff who work with clients so they can see everything. And then program managers cannot see client charts for other programs, but they can see the metrics for other programs. So it's not a completely open environment. And that's part of HIPAA, is that you have to be very careful what you allow people to see and what you don't.
Okay, great. All right, thank you again, Bob. So a couple things just to wrap up. So some of the kind of overall key takeaways, right? So you heard results and takeaways from each speaker. Overall, we talk about managing by the metrics with Salesforce.com. So the first thing I think you kind of heard a common thread through all three speakers is, identifying your business goals, right? Identifying the business goals and designing the analytics around that. The analytics that'll help management and executives measure and monitor the business, but also the analytics for those business goals that'll help drive performance from your reps themselves or your users themselves. Compliance. You heard a lot about compliance. Every speaker up here talked about compliance. They approached it in different ways because they're all unique to their own business. But the nice thing about it is you saw and heard some great stories on how they're using Salesforce custom objects as well as our analytics to really measure and monitor and really drive behavior toward regulatory pressures and compliance that's unique to each of their industries. The other nice thing about it is you heard a couple stories about real time, right? Measuring in real time. And so the nice thing, again, with Salesforce Analytics is that once the data is in the system, you have real-time access to reporting on it, whether it's compliance or marketing operations or community events, center of excellence, whatever it might be. It's all real-time. And finally, kind of old cliche, but really begin with the end in mind, right? Try to figure out, what are you trying to get out of the system? Are you trying to achieve that compliance? Are you trying to stay on top of regulatory changes? Are you trying to get your hands around all those marketing /sales /community relations efforts or whatever it might be? But begin with the end in mind. Look at what you're trying to achieve, and then work backwards to rolling that out in Salesforce.com. Real quick, just housekeeping item. If you've been to any of the breakout sessions, you've heard about the giveaway, right? So if you go upstairs, you've probably seen the big booth. We're giving away 14, I think, iPod Nanos, I think, every day. Yeah. So if you go to one of those booths upstairs, fill out a survey. You can also just pick up a computer anywhere and log into your Dreamforce portal site and do it on there as well. But fill out a survey, please, for a session here, and you'll automatically be registered for one of those great iPods for your long flights home. So that's it. We'd like to now open it up. We have a little less than, 8 minutes, 7, 8 minutes for any open questions for the guys. Yes, sir. Okay. Let me give it to you anyway.
With your clinicians out in the field, do they have any issues with doing their data collection, carrying laptops out in the field? Does that become an issue at all?
Well, actually, our clients like to steal our laptops. So the people are panhandling. In between panhandling all you tourists, they're stealing our laptops. But that's good because, from our point of view, not good that they're stealing them, but good that there's no data on them. We're trying to switch over to iPhones for data entry because it's cheaper when they're stolen. And seriously, we've also been trying to work with this company that sells a pen that's got a little camera in the nib, and it's got a handwriting recognition software. And so our clients also believe that all computers are connected to each other and to the FBI, which actually may be true. But so what we will do with this pen, if we can get it to work, is they'll fill out the forms on paper, and then they'll dock the pen to their computer, and it will upload the data to the client's chart.
Yeah, we've actually used that pen, and it actually Bluetooths right to your BlackBerry.
Yeah.
The one I use.
Oh yeah.
Yeah, we've tested it.
Yeah. So I think we're going to, and also they're again cheaper if they're stolen than laptops. So we're thinking of doing that as well.
We've addressed the same problem with security. You got one there?
Oh, yeah.
Cool. We've addressed the same problem, and that is our answer, too. The beauty of Salesforce is that the laptop is just a brick. We even have software on it that'll kill it if you don't log in right. And all of our data is, not there. They've got a wireless card, and so the computer is really just a tool, not a storage device.
One comment to make on kind of mobile solutions. I don't know if there's any biopharma in here at all, anybody in the pharma space, but a lot of times, and that's a great example of one of the industries. I see this a lot, but the need to go to physician offices and actually capture signatures, actually written signatures. So we have a couple partners out here. I don't know if anybody's visited Model Metrics and a company called Viva that's very unique to that space. But they have like offline client solutions where you could literally go, like in the pharma space, you can go and track sample management, what samples are getting dropped off of physicians' offices, and literally capture electronic signatures right there on the device. Pretty interesting. Any other questions?
This is kind of for Bob, but maybe you other gentlemen could chime in. Your point about using analytics to teach people how to manage. I'm very curious on how you did it. I'm going through that myself right now, where my CEO has directed me to identify some key essential metrics for each department. I'm meeting with the department heads, but they wouldn't know a key essential metric if it hit them in the face. So did you have to sort of lay down the law on what you thought
Well,
these metrics would be? You see what I'm saying?
A little of both. I think what you want to do in your role is really have a conversation about what they are trying to accomplish. Because if you're not measuring what they think they're trying to accomplish, you're not going to measure anything that's going to get buy-in from them. And then you've got to turn it into a metric. And so it took us about a year to go through all 25 programs and come up with real metrics. But the second thing is you've got then to hold them accountable. What we said with these 3 metrics was we're going to give you a month. If you need somebody to sit with you every minute of this month and help you use the system, we're going to do that. But after that month, we are going to hold you accountable for meeting these metrics. And at the end of the second month, we wrote a few people up, or we counseled them. Second month, we wrote them up. The third month, we fired 3 people, which wonderfully concentrated the minds of everyone else. But the thing was that those 3 people were completely astounded that we actually fired them because they weren't doing their jobs. And the other part of the message is if you work for a nonprofit, you work for a low wage, that doesn't mean you get to provide lousy service to poor people. And that was the other message. That's what we said at the start. And when we fired those 3 people, that really confirmed the message with the rest of the staff. Didn't make me really popular, but it sure spurred adoption.
One question to all of you 3. The chatter yesterday you saw and presented from Mark, is this helpful in your business? What do you think? Is this a tool you will think about? Will it support something of your business cases you were thinking about in the past? Is this a helpful tool? Or any idea what you can do with that in future?
On the chatter?
Yeah.
Yeah, I mean, we've had requests internally within Zimmer, I know, for that functionality within our sales organization for sure. But the big issue goes right back to compliance and regulatory legal. They are saying, hold off on that functionality. So until we can monitor it and figure out how people are compliant, that's going to be our challenge. There's definitely a need for it, no question.
Yeah.
I saw the demo more detailed yesterday, and I was just astounded by, because when Mark conveys it, it was kind of like, okay, what's there? But to actually get your hands in there in the booth at the expo and see, even on an opportunity, right, and say, here's the chatter that's going on within your sales team, some things you got to talk about real quick, and the mobile integration that's going to come with it. There's no question we're going to see value. But it's back to that free text again for us. It's going to be a struggle.
One of the things that's nice, though, is like with what Don has done with the free text, your free text compliance tracking analytics, all of that data, the chatter data, is still sitting in the Salesforce platform, the Salesforce database. So like the analytics that he showed, where it showed the free text words that are, the no-nos, or whatever you call them, right? The words that shouldn't be chatted about, you could still run the same type of searches and analytics on the chatter conversations because it's all sitting in that same Salesforce database.
I thought it was 7 words.
It was what?
Never mind. Just a joke.
Well,
Any other
one other comment is, like I'm sitting here today, for the whole week we were at Dreamforce, everybody in my Facebook knows it, right? Everybody in my LinkedIn knows it, but our own company doesn't know it, right? Except my 5 people that are in our
on
group.
Facebook, right? Yeah.
Right.
Yeah.
And so when you say chatter, it's like, here's where this user's at, company, and the power in that alone, we're getting hung up on the compliance and legal stuff again, so. It's going to be a challenge for us, but it's definitely valuable.
Bob or Paul, did you have any comments on the chatter?
We're very excited about the social area. A huge preponderance of our members are children, and their moms are generally the household, head of household, and they're young as well. And social media is very interesting to us, and our marketing folks are also young, and they're from the community. So we believe that there would be opportunity to use it. The mountain we have to climb over to get to the other side is dealing with the unknowns of compliance exposures and brand exposures and those sorts of things, which, we're a big accounting firm, basically. And we get $5.5 billion a year, and we write checks, and our CEOs and all our plans are all accountants. You know, everybody's, and so we're not that ready yet for that sort of thing. So I think it's going to take us a while to absorb it. We are running a Facebook pilot down in Atlanta now. But we'll see how it goes.
Well, most nonprofits are both political as well as service organizations. And we've been looking into social media and just trying to figure out how to make sense of it, to get to really use it for our purposes. Chatter itself, again, it comes up, you have some regulatory issues that we have to look into. But part of the problem with Salesforce is it gets so much capacity so fast that sometimes you just get exhausted trying to keep up with it. That's part of what I felt like, oh my God, you know, we just got 2 people trained to do Force, and now we got to do Chatter.
Sorry.
Well, on that note, we are exactly out of time. So again, I want to thank the speakers for attending. Thank you, guys.
Good to meet you. Good to meet you.
And we'll all be around for a few minutes if anybody has any direct one-on-one questions. And thank you all very much for coming out here, and safe travels home to wherever you're going.